Swastiastu. Hello everyone, today we're from SGD B8. We'll present you our student project with the title of Granulomatous Inflammation in Tuberculosis. Next. So this is the member of SGD B8 itself that have made this student project. Next. The first topic about the background will be delivered by my friend. Thank you.
Hello, my name is Mary. Here I'm going to explain the background of our project. So, granulomatous inflammation is a typical pattern of chronic inflammation that can be found in both infectious and non-infectious conditions. Besides of that, tuberculosis or TB is a contagious infectious disease that can be caused by Mycobacterium tuberculosis bacteria, which can attack various organs, especially the lungs. Additionally, 1/3 of the global population is considered latently infected and is at risk for reactivating disease. Human infection with mycobacteria, including the etiological agent of tuberculosis, which is Mycobacterium tuberculosis, is a potential trigger for granuloma formation. Therefore, understanding granuloma inflammation in TB is an important global health agenda. That's all from me. Next will be continued by my friend. Thank you.
Okay, my name is Gloria, and here I present you the problem formulation. Next. Objectives and benefit of our study. So based on the problem formulation, the objectives are to define what is granulomatous inflammation and granulomatous inflammation in TB, to describe the development, to explain the testing methods, to use for finding out granulomatous inflammation, and to explain the treatment for granulomatous inflammation in TB. And by knowing the clinical implications, we could likely prevent the event. Also, as a medical student, this study increased our knowledge before making direct contact with the patient. Next.
Okay, my name is Panika Putri Rahaindrayani, and now I would like to explain about the definition of granulomatous inflammation. Granulomatous inflammation is defined as the microscopic anatomical pattern of tissue reactions that occurs after cell injury. It is a distinctive form of chronic inflammation reaction that is characterized by the presence of macrophage, epithelioid cells, and multinucleate giant cells. Granulomatous inflammation can indicate the presence of infectious, toxic, allergic, drug, autoimmune, and neoplastic diseases, as well as some unknown etiological conditions. Granulomas can be produced by various infectious agents, each of which exhibits a different microorganism. There are several common reaction patterns such as necrotizing granulomas, non-necrotizing granulomas, suppurative granulomas, diffuse granulomatous inflammation, and foreign body giant cell reactions. These inflammatory reactions are characterized by focal lesions called granulomas. In addition, there are usually other cells, especially lymphocytes, plasma cells, and fibroblasts. Agents that cause granulomatous inflammation cannot be degraded by polymorphonuclear leukocyte, macrophage, and other chemical mediators related to the inflammatory reaction.
Okay, hello everyone. So my name is Stefan Christian Surya with name numbers is 200251150. So I will present the granulomatous inflammation in tuberculosis. This inflammation works against the existence of pathogens is by weakening and stopping the spread of microbial infections. The granulomatous inflammation can be found in body tissues that are infected by pathogens such as bacteria from the Mycobacterium genus, like Mycobacterium leprae and Mycobacterium tuberculosis, virus, parasites, and fungi. Granulomatous inflammation also can be found in various organ system in our body, such as respiratory system that affected by TB disease, the urology system that affected by granulomatous interstitial nephritis or GIN, and the integument system which infected from exogenous, endogenous, and hematogenous pathogens. In granulomatous tuberculosis, the macrophage can diffuse into a large multinucleated cell called Langhans cell, which has lymphocytes act as the first layer on the outside layer of the cell. The lesions from granulomatous inflammation events in tuberculosis disease can be necrotic and non-necrotic. The necrotic lesions are more expensive than and can cause a change in the structure of organ that is encountering the disease. Next.
Thank you, Stephanus. My name is Sofia Charya Paramita, and now I am going to explain about the histologic characteristic of granulomatous inflammation in tuberculosis. Granulomatous inflammation itself is usually characterized by the formation of distinct granulomas. These granulomas consist of aggregated epithelioid histiocyte and sometimes a necrotic center that's shown in the picture below. There are various types of granulomatous inflammation in tuberculosis. HNE and AFB staining methods are usually used to color lung section to prove the existence of granulomatous inflammation. There are a necrotic center with a thickened wall, fibroblasts, and leukocytes that are scattered across a closed fibrotic causes that has been stained with HNE staining. That is all from me. Next.
Okay, thank you, Sophie. My name is Fira Jonathan. With the last digit of my NIM is 164. Today I'm going to explain the pathogenesis. The disease pathogenesis depends on the host ability to remove the bacillus. The principal path of the infection is the respiratory route. The infection begins when the droplets from people who are actively or recently infected enter the healthy individual's respiratory tract. These droplets store a small number of bacilli that penetrate the lungs, where is the alveolar macrophages, type 2 pneumocytes, and polymononuclear neutrophils are mainly contaminated. The infections present few health issues for most people, since the bacteria have evolved an ability to live in equilibrium with immune response. This bacillus is a highly efficient human pathogen, which without the causing clinical illness could infect the host for decades, with reactivation resulting only when the host immunity is weakened. Maybe that's all from me. Thank you. Next.
Okay, so hello everyone. My name is Joko Desina dari Pemayun, and I will explain to you the development scheme of granulomatous inflammation in tuberculosis. So the first step is the T cells are triggered by antigen-presenting cells represented by dendritic cells and alveolar macrophages. The second steps is that cytokines and chemokines will be released by macrophages. Then there will be an activation of lymphocytes, dendritic cells, and polymorphonuclear cells. And the third step is that both chemokines and cytokines retain in the lung, specifically in the immunoinflammatory cell population that is occur in the lung. And the last step is that in granulomatous diseases, the last phase of granuloma formation usually ends with fibrosis. That's all for the development of the inflammatous granulomatous in tuberculosis. Next will be delivered by my friend. Thank you.
Hello everyone, my name is Cassandra with my last three name digit is 152, and I will continue about the causes of granulomatous inflammation in tuberculosis. The introduction of Mycobacterium tuberculosis bacilli by phagocytic cells triggered the activation and production of cytokines, and chemokines. There are two types of cytokine groups that play a role in the immune response to tuberculosis, namely pro-inflammatory and anti-inflammatory cytokines. A number of pro-inflammatory cytokines are involved in the infection process of Mycobacterium tuberculosis, including interleukin-8 or IL-8 that is involved in the immune process against Mycobacterium tuberculosis infection associated with tissue inflammation and granuloma formation. This interleukin-8 attracts T cells into tuberculosis granuloma formation. The next explanation will be continued by my friend. That's all, and thank you.
Okay, my name is Gloria Grace. I will continue Cassandra's explanation. So, immune surveillance and direct local immune responses are the central activity where granulomas engage in. CD4 plus T cells, CD8 plus T cells, and B cells are several common types of cells that are associated with granulomas, whilst the most specific and fundamental cellular element of this lesion are macrophages. Cytokines such as tumor necrosis factor alpha promote the functional integrity of granulomas. That's all from me. The next slide will be continued by my friend. Thank you.
Hello, my name is Tavia Sianto with the last three NIM number 163. Here I'm going to explain the microscopic and macroscopic overview of the granulomatous inflammation. So, microscopically, the granulomatous may show up by the epithelioid macrophages and simultaneously with lymphocytes, plasma cells, fibroblasts with collagen, and probably some of MNs. Moreover, the center is filled by caseous necrosis. The infection may come along with type 4 hypersensitivity reaction. Macroscopically, the granulomatous infections brings up tubercles within the cavity between both ears, perturbing the mucosa in the upper part, the inner surface of tympanic membrane, and the antrums mucosa. Those tubercles will fill the caseations and necrosis of the bones. The inflammation around the ossicles will also affect the absorption and the disintegrating of ossicle spike. That's all from me. Next will be dealt by my friend. Thank you.
Okay, thank you. My name is Naomi, and the last three digits of my name is 167. Now I'm going to explain the testing method that can be used to detect the SGD disease. Actually, there are two clinical tests that are widely used for provisional diagnosis, which are first, nitroblue tetrazolium test or NBT. NBT is a blood test that measures the ability of human system to convert the colorless nitroblue tetrazolium or NTB to a deep blue formation to form deposit in the cells. Classic chronic granulomatous disease or CGD patients do not show formation formation. Furthermore, this NBT test is performed as a screen for chronic granulomatous disease, and this test is subjective based on microscopic examination. And the second test is the dihydrorhodamine test or DHR. This test is an objective flow cytometric test. After stimulation of portable myristate acetate of phagocytes, DHR was oxidized intracellularly to rhodamine 1,2,3 by diffuse hydrogen peroxide. This test should be performed and used carefully. And in addition, this flow cytometric test is now widely and commercially available and can be considered as the preferred screening and diagnostic test for chronic granulomatous disease. And that's all for me. The next slide will be presented by my friends. Thank you.
Okay, hello, my name is Rizky, and my last three-digit name is 158. So, in present days, scientists have developed new method of treatment using new efficient drug that shorten the treatment period and even reduce the morbidity and mortality rate of patients. So, in the table of drug restoring inflammatory pathway in granuloma dissociation, the first one is etanercept. The pathway is TNF alpha, and its mechanism is to block TNF alpha access. and the outcome is to decrease bacterial burden and pulmonary damage. And the developmental stage is preclinical. And the second one is dilueton alox 5, and the mechanism is to restrict inflammatory eicosanoid synthesis by suppressing lipoxygenase function. And the reported outcome is bacterial burden reduction and improved survival susceptible mice. And the developmental stage is preclinical. The next one will be delivered by my friend.
Okay, thank you. Hi everyone, my name is Janinta Ayu Ardiantindepari and my last three-digit student number is 159. The third drug is ibuprofen. It enters through eicosanoid pathway and it uses inflammation by potentially modulating the development of eicosanoids against inflammation. The reported outcomes is to increase survival of mice infected with Microbacterium tuberculosis and decrease inflammation of the tissue. It is working on the developmental stage in preclinical stage. And the last drug used is simvastatin. It enters through cholesterol pathway and it inhibits cholesterol biosynthesis and increases autophagy and maturation of the phagosome lysosome. The reported outcomes is to increase survival of Microbacterium tuberculosis infected mice and ameliorated tissue pathology, and it works in preclinical on its developmental stage. The next one will be delivered by my friend. Thank you.
Hello, my name is Felicia with 3 last digit of my name 166. So I will present to you the conclusion of our material, which is the granulomatous inflammation in tuberculosis. So there are some important points about our materials. The first one, Mycobacterium tuberculosis, a bacteria from Bacillus genus, caused an infectious disease called tuberculosis that mostly attacked the respiratory organs of humans, particularly the lungs, but it can also invade the other region of the body, such as spine, lymph nodes, bones and joints, genitourinary system, and also the brain. One characteristic of Mycobacterium tuberculosis infection is the presence of granulomatous inflammation. This granulomatous inflammation can be seen under microscope with hematoxylin and eosin stain or acid-fast bacillus stain methods. The immune response to Mycobacterium tuberculosis are divided into cytokine and chemokines. For cytokine, there are pro-inflammatory and anti-inflammatory cytokines. For chemokines, there are interleukin 8 and monocyte chemoattractant protein 1 or MCP1. Sputum is the most common specimen screened from TB patients that are used to continue the diagnosis for TB patients or continue the medication. There are two clinical tests which are widely used for conditional diagnosis, which are nitroblue tetrazolium test or NBT and dihydrorhodamine or DHR test. The last one, treatment for tuberculosis is usually in a long period where sometimes incomplete treatment or even maltreatment can happen. Several drugs that are used to delay those side effects or those impacts are etanercept, dilueton, ibuprofen, and simvastatin. That's all about our conclusion for our material. The next slide will be presented by my friend. Thank you.
So these are the references that are being used to make this student project. Next. Okay, so that's all for the student project that we have made. We're very sorry if we made any mistakes. Thank you for watching and have a nice day.